months after the largest nurses strike in Oregon's history, some Providence doctors may do the same. Healthcare workers at 2 of the hospitals have now voted to authorize a strike, which would be the first doctors' strike in Oregon's history.
Fox 12's Carly Olson joins us live now from outside one of the locations where doctors are in negotiations. Carly?
Pete and Nora, I'm here at Providence St. Vincent in southwest Portland. Now, doctors, physicians, associates, nurse practitioners, and more have now voted to authorize their bargaining teams to call for a strike. This would be the second massive strike at Providence this year, and both sides tell me that the coming days will be crucial in making or breaking that next step. In June, we watched as 3,000 Providence nurses took to the sidewalks, making demands on staffing levels and benefits. Now, in October,
we've realized, unfortunately, that if we don't stand up for that, then nobody else is going to.
Doctors to nurse practitioners to midwives from St. Vincent and the Women's Clinic are eyeing that same sidewalk as they seek demands that sound all too familiar.
Our physician workforce has not been growing. Our model of compensation is really old and hasn't adjusted to provide us a balanced life.
Back then, we didn't have patients waiting several hours in the ER to be seen. Our numbers have steadily increased, and as a physician, it affects us on a personal level to know that we can't get to everybody that needs to be seen on time or in a timely manner.
It's a first contract for these particular employees who just unionized within the last year. They say they've negotiated for staffing levels and competitive compensation for that entire time.
We feel like we are, making progress.
Providence, Oregon CEO Jennifer Burrows tells me they engaged a federal mediator and were able to come to agreements on 4 issues last week. But there are still 19 points of contention. She says, unlike with nurses, doctors do not have a replacement workforce, and the impact of a strike could be extreme.
It is unprecedented. If we get to a place where a strike is actually called, it will have impact because we will not be able to care for the same number of people.
But those on the front lines and the hospitals tell me if things don't change, they will only get worse for everyone.
I am not sure I would be inspired to stay for the long term given the current climate. The short term obviously is heartbreaking for us to create an access problem for a short amount of time, but we're doing it for the sustainability of the care stream in the long term.
It's our responsibility to stand up and make sure that our community gets the care that it deserves.
The Oregon Nurses Association tells me that those nurses who went on strike this summer are still in negotiations, and they could also be looking at another strike. Burrows tells me that the union has made it clear to them that they intend to carry out a larger strike across several hospitals and across several roles as well. But for now, things remain unclear as negotiations continue this week. Reporting live in southwest Portland, Carly Olson, Fox 12 Oregon.